likely going to be on carbidopa-levodopa, which is also called Sinemet. So I'm not getting into all of the different medications that people could be taking, because there's a lot, but the biggest one, the gold standard, which I would say 75 to 80% of people are on, if not more, is the Sinemet. A lot of the other medications that people take have the same side effects as Sinemet. So when we talk about the side effects, you can just kind of extrapolate them to the other medications as well. So carbidopa-levodopa is a medication that people take to control their motor symptoms primarily. It's a medication that most people take multiple times a day, and one that doesn't work for a super extended period of time. So a lot of folks take their medication at like 8, 12, 5, and 9, for example. When they take their medication and they have that medication schedule, it is very important that they stick to that schedule. A lot of people over time experience what's called wearing off or on-off periods or motor fluctuations. So basically all of those things are a result of the medication not being optimally in their body. So you guys might see this in class. Maybe Bob comes in one day, he's cycling really good, and you're like, oh, awesome, he's going to do great. And then he comes in a couple days later, and he's really slow, and he just doesn't seem like he's with it. Maybe he missed a dose of medication. So we'll kind of get into some ideas to make sure that people really do take their medication as scheduled, because it's very important. So carbidopa-levodopa is actually two different drugs. Carbidopa is a medication that is mostly used to stop the absorption of levodopa until it gets to the blood-brain barrier. So the reason for this is if you just took levodopa by itself, people would not be able to tolerate it because it causes such GI upset, like so much vomiting, so much discomfort. So the carbidopa is used to help prevent that nausea and stop the medication from breaking down until it gets to the brain. And the levodopa is a synthetic kind of precursor of dopamine. So once it crosses the blood-brain barrier, it converts into a dopamine-like substance. So it's kind of replacing that depleted dopamine that people have in their brains, which sounds pretty good. However, it is only symptomatic relief, and over time, people need more and more and more of the medication. And people do reach a point where they can't take any more medication because the side effects are very profound, and also the disease itself is spreading. So it's not just isolated to dopamine-producing neurons, it's spreading to other areas of the brain too, and affecting movement in other types of ways that the carbidopa-levodopa is just not going to help anymore. So side effects, there's a ton of them. Again, nausea, vomiting, hallucination, psychosis, dizziness, falls. Usually after someone is on carbidopa-levodopa for about 5 years, they're going to start falling for the most part. Because the medication causes issues with blood pressure and does not work on helping with balance, it actually makes balance worse over time. It's good for rigidity. It's good for bradykinesia, for slowness of movement, and it's good for tremor, but it's not good for helping with balance. So what else did I want to say about medication?
So are they given another medication after 5 years? Are they reevaluated?
Yeah, sometimes. So this is the gold standard. This is typically the best way to treat it with the least amount of side effects. So sometimes a neurologist will add what's called like a dopamine agonist, which acts like dopamine, and they may supplement with that, but that causes, for a lot of folks, like really bad psychological symptoms like major hallucinations and confusion and falls. But sometimes the doctors will give medications that actually slow down the breakdown of dopamine in the brain so that dopamine is actually circulating in the brain longer. Like we make dopamine, we use it, and then it's broken down. That's just how it works normally. So there are medications that will keep dopamine in the brain longer, but what we tend to see when these medications are used, at least after a while, are dyskinesias, which which is too much movement. So instead of people moving small and slow, I actually work with a couple guys like this right now. They're like all over the place, and they're quite scary actually to work with because they're all over the place. And the other thing is we do see a lot of impulsivity with those medications too. So just something to keep in mind. People may not always make the safest decisions, and part of that is because their medications just make them really impulsive and can cause impulse control disorders. So yeah, the medications help. They have to take them or they can't move, they can't get out of bed. But there's tons and tons of negatives to it too, which is why exercise is so important. So we'll talk about that in a sec. So then you may have people, another option is DBS, or deep brain stimulation. So if somebody says that they have DBS, they're talking about deep brain stimulation. And what this is, it's a pacemaker for the brain. So it's a surgical procedure that's done where the doctor, the person is actually awake for the surgery, and the neurosurgeon puts these electrodes down into the deep nuclei of the brain, and it's attached to a lead, and then to like a kind of like a neuromodulator that delivers continuous electrical impulses. And it's really interesting because we don't really know exactly how it works, except for it helps to decrease abnormal firing in the brain. So it's not replenishing dopamine, it's not really changing dopamine levels, but people with Parkinson's also have very random, erratic firing in their brains, and this kind of helps tamper that down and calm it down. So side effects too, seizures, infection, headaches, stroke. It's definitely major surgery, it's brain surgery, but for some people who don't respond particularly well to the oral medications, this is a good option. People who take or who have DBS oftentimes are able to take less of the oral medication. They kind of balance each other out a little bit. But it's not good for people with any cognitive issues or dementia, because DBS oftentimes worsens confusion and dementia. So it's also not a perfect therapy. It is approved for people who've had Parkinson's for 4 years or more. So people who are recently diagnosed, immediately diagnosed, aren't eligible yet. And it treats motor symptoms only. Again, it's good for rigidity, it's good for tremor, it's good for slowness of movement, but it's not good for helping with balance. It doesn't help with balance at all. So that's about it for DBS. And it really shouldn't affect your people with